I'm going to talk to you a little bit about how to write the discussion in a thesis. Now, I don't have to tell you that this is the most difficult part of a thesis to write. The difficult part because it requires a lot of skill is of the thesis is this. But before I begin, today is 1 year since my teacher, Professor C.H. Sashindran, passed away. He passed away last year on September 11, 2020, and I am dedicating this webinar to him because it's because of him I am today able to teach, because I think he was a teacher par excellence. So may he rest in peace, and I am deeply indebted to Professor Sashindran for all the kind of interactions I had with him. I was his first MD student who did MD under him. I was also his first PhD student, so I owe a lot to Professor Sashindran. Okay, so let's come to my talk today. The objectives of my talk today is that I expect all of you to be able to explain the purpose of writing a discussion. What are the elements of a discussion? Even if you don't know anything else, you should know the elements of a discussion, and what the do's and the don'ts. And so you will be able to guide your student to write a good discussion in the thesis. So those are the objectives. So there will be an introduction. What is the purpose of this? What should be the length? What are the elements? What to avoid? What are the common mistakes we make? And then I will talk a little bit about the reporting guidelines. So that's my plan for today's session. So discussion, as I said, is the most difficult part to write because there is no structure. There is no formal structure to a discussion part. No journal actually asks for a particular structure, and therefore it makes it a little difficult. It also requires a good depth of knowledge, and you should have fairly good writing skills. Generally, these skills are passed on from a senior to a junior author. As I told about Dr. Sashindran before this, I rewrote my discussion section of my section of my thesis 3 times, starting from scratch. Okay, so this is it is actually passed on from senior to junior, who train or sort of mentor the residents to write this. One thing we should be ready is be patient and be prepared to do many drafts. Don't shy away from making many drafts. And so the last thing is the discussion section answers the question, so what? Sir Bradford Hill asked 4 questions, and the 4th question or the last question was, so what? So what does it mean, all your results? What does it mean? That is the question he was asking. So the purpose of a discussion should be to emphasize the new and important aspects of the study. That is, whatever work you have done, and the conclusions that follow them in the context of the totality of the best available evidence. So in the discussion section, you're trying to explain your findings in the background of the best available evidence there is. So that is what you're trying to do in the discussion. Now, what you should not do is you should not repeat in detail data or other information which is given in the introduction or result section. This is the common mistake which people do. They will start the discussion section by starting out with, we started to do this study by wanting to find out what this was done. That is how we generally start the discussion. That is what we should not do. So this is the purpose of the discussion, and please, it should be used to interpret the results. Okay. So this is what an discussion section is. But interpretation can easily go wrong, and I'll show you why. See, this is the person, the researcher is the one taking the photo, and he's taking the photo of his feet on day 1. Then on day 10, this is the photo he takes. Okay, he's wearing the same clothes also. This is on day 20, and on day 30, this is what he can see, right? So the size of his feet have reduced. Now, if he concludes that quarantine makes feet smaller because he is under quarantine for 30 days. Is this the correct interpretation of the data he has taken? The data is he has taken photographs. Okay. So what I mean to say is writing a discussion needs a lot of thought, and you need to interpret your data in the light of what is known. So please be careful about writing the discussion. So how long should it be? Now, this is in a manuscript. The same thing would be for a thesis also. But if the manuscript is 3000 words, then it should be around 900 words discussion, okay? Or 3 to 4 double-sized A4 size pages. Now, in a thesis, we expect it to be about 4 to 5 pages, about 1300 to 1500 words, okay? So this is the general length, 4 to 5 pages of a discussion is expected. Now, what are the elements? I told you this is a very important thing. So elements, the first element of a discussion is you should state the main findings or results of your thesis. What is the main or important finding of your thesis? You should write first. And the next element is where you compare the results, your results, with earlier studies, previously done studies. Whether your results are congruent or do they oppose those results, you need to discuss that. The third thing is how strong is your study? What are the strengths and limitations of the study? How can your results be generalized to the populations elsewhere, or to the general public, or to that particular illness, disease, whatever it is, depending on the type of study? And what are the implications of it for future research or for policy implications? And then you conclude and give directions for future research. So in this book, this is what these authors have written, that these are the elements of a discussion. Main findings, compare the results with earlier studies. How strong is the study? What are the strengths and limitations? How can you generalize your results? What are the implications for future policy? Dr. Raj Kishore, can you please mute your thing? Then what are the conclusions and directions for future research? So these are the elements. But if you see these elements, this how strong is your study, it's actually included in the strengths. When you say how strong is your study, you want to say what were the bias eliminating techniques which you did, what was your sample size, then did you do post hoc analysis, what was the power of your study. So these elements are generally put into strengths and limitations. Okay, so we can leave out that element. Then this implications for policy, future research, these two things, both generalizability as well as implications, are generally put into conclusions. So ultimately you get only 5, right? Only 5 elements will remain, because generalizability and implications will go into conclusions. How strong is this study will go into strengths and limitations. So let's come to the first element. State the main results or findings. So you should use the first 2 to 3 paragraphs to state the central findings or answer to the research question. The first 2 or 3 paragraphs, okay? Don't give the objectives or study design or the results or anything like that. The main findings you should give in the first 2 or 3 paragraphs. So you should make direct declarative statements of the main findings, and you can explain the meaning of your findings and why they are important. So this is what we mean by state the main results or findings. Now, why do you have to say that? Explaining the meanings of the findings and why they are important, because if you remember, I said, what does this study mean? So what? That is a thing which you are trying to answer in a discussion. So therefore, you need to explain why the meanings and the findings are important. You also need to relate your findings to similar studies. So you will need to do a little bit of literature search. and see how the other studies or what the findings in other studies have been. You might have some studies already you have done in your review of literature. Then supposing the findings are different, see whether you can look for an alternate explanation of the findings. And then what is the clinical relevance of whatever you have found? Sometimes you might find a very significant result, but it may not be clinically very relevant. So you will need to state the clinical relevance of your findings. And in case you have some negative findings, you may want to report any unexpected and negative findings. So this is how you state the findings of your work. Explain the meanings. Why is it important? Relate it to other similar studies. Consider alternate explanation of the findings. Then state clinical relevance of them, and then report unexpected and negative findings. So this is how you write an effective discussion. Now in this talk today, what I'm going to do is I'm going to just take a paper and use the discussion section of this paper to explain the elements. Okay. So this is a paper which was published in New England Journal of Medicine in February 1st, 2018. It was again just picked up by me without any this thing. Now the title of the paper is Catheter Ablation for Atrial Fibrillation and Heart Failure. So these workers, these scientists, what they have done is they have initiated a trial called catheter ablation versus standard conventional therapy in patients with left ventricular dysfunction and atrial fibrillation. So they are calling it the Castle AF trial, and they want to address this issue, whether they can do catheter ablation or standard conventional therapy. These are the two things they have tried to compare in patients with atrial fibrillation and heart failure. So I'm just going to look at the discussion section of their paper. Okay. So the way they start the discussion, this is the first sentence in the discussion. In the Castle AF trial, we found that the use of ablation for atrial fibrillation in patients with heart failure was associated with a significantly lower rate of a composite of death and hospitalization for heart failure than medical therapy. So as you can see, this is a total topic sentence they have used. They have said this is their main finding. Their main finding was that this catheter ablation was far superior. It reduced death and hospitalization for heart failure than the standard therapy. That is the first thing they are saying. So the main findings are stated first. This is how you state it. Okay. Now, if you look at the second sentence, we also found that there was a benefit in all-cause mortality alone, which was driven by a significantly lower rate of cardiovascular death in them. So this is their secondary finding there. So that also they have given. So the main findings is what you will put in the first 2 or 3 paragraphs. Now they have gone on to say, several trials have reported improvements in soft endpoints with catheter ablation. So as I said, what are the similar studies? They are comparing with other studies. So they are saying other studies also found have found improvements. And then they have gone on to say what other people have said. So that is the second one. So the first one was state main findings. The second element is to compare with other studies. Okay. So then they are saying in the Castle trial, that is in the trial they have done, in contrast to previous trials, we evaluated hard primary endpoint of death or hospitalization for heart failure. So what are they trying to say? Unlike other studies, in contrast, this is what we have done. They are citing their strengths. They are saying, what did we do differently? We have evaluated hard endpoints, and we followed up our patients to assess long-term outcomes. So they are talking about what they did differently from other people, isn't it? So they have compared with other studies, and they are saying what they have done differently from other studies. These are the strengths, because they are saying the other studies didn't look for long-term outcome. We look for a long-term outcome. Our endpoints are also hard endpoints. So these are their strengths which they are writing. Okay, so this is the third element. So state the main findings, compare with other studies, then strengths. They are talking about the strengths. Strengths and weaknesses, both will be the third point. So here they are writing about their weaknesses. One of the limitations of our trial is the lack of blinding. So can you see strengths and weaknesses, strengths and limitations. So limitations they are writing that their study doesn't, there is lack of blinding. And they are going on to say why they could not blind the one arm. So this is, you have to state the limitations of the study. So stating main findings, compare with other studies, strengths, limitations, and then now they are concluding. So they are concluding what they are concluding, that in comparison of this with other this thing, this is what we found. That they are trying to write their conclusions. So the 5 elements of the conclusions are there in a paper. In any JAM, I just picked out a paper. If you take any good journal, you will be able to find out these 5 elements. Stating the main findings or results, they will start with that. Then you compare your results with other studies. Either you did the same thing or you did something else, you got the same results, or if you got some other results, can you explain your results? What were the strengths of your study? What were the limitations of your study? And what are the conclusions? So these are the 5 elements of a discussion. Please remember this. Generally, I tell my residents what you should do is you take a blank paper, you type the first element, leave some space, second element, leave space, third, fourth, like this, and then you start filling up under each thing, and then you remove the headings. That's it. That's how you write your discussion. But if you stick to these kind of elements, no, there is a kind of a you know what is expected to write, you will not go wrong. So just to break the monotony a little bit, this the guide is saying, oh, really, it's nice there, but are there no limitations? So this fellow is saying, yes, there are. These are summed up in this separate appendix. So he has so many limitations that he is having a huge book of limitations. Okay. So this is what I said. This is how you start writing. Open a page, write the elements. Then you fill up under each of the headings, and then you check for overlap. If there is overlap, you remove it. That's it. So what do you avoid in a discussion? First is you should avoid over-interpreting the results. Now we are so fond of our studies, we generally try to write a little too much about the results and try to over-interpret when there is no data to back this up. We also like to do unwarranted speculation. See, we would have done a study on healthy volunteers. Let's say you give some fruit or some vegetables juice in healthy volunteers, and you are seeing a small fall in blood sugar. Then you say that we are very certain that this will be useful in diabetes mellitus. Okay, so this is a bit unwarranted, because healthy volunteers, you cannot go from healthy volunteers to diabetes straight off. Okay, so you need to be very careful about what you are writing in a discussion. Inflating the importance of findings. Supposing you have done a small study in a small number of subjects, don't suddenly say that this will be useful for the entire world. Okay, it's like that. You should be careful when you are interpreting your results. Also, sometimes people try to take off into tangential issues which are not related to your studies. Again, you should avoid this. Then do not discuss new data which is not presented in the results. See, sometimes you might have got some data which you are not presenting it. If you are not presenting it, do not discuss in the results. So the interpret or discuss only those results which you have written about in your results section. New data cannot be discussed in the discussion if you have not already presented it in the results. So this is what you should try to avoid in a discussion. Now, when you're talking of overinterpretation is in results, I am telling that supposing you have taken a sample and the conclusion should take into account the bias in sample selection. If you've not done any bias eliminating techniques, if you've not randomized, if you've not, supposing you are having 2 arms, if there is no control arm, then your conclusion should take into account the fact that you don't have a controller. Okay. Similarly, the results may show an increase or decrease which is not statistically proven. Sometimes when you finish your study, it may not be statistically significant. Don't suddenly say that there seems to be a trend in increase and therefore this will be some of this thing. If something has increased, it should be statistically significant. Either it is statistically significant, only then you can say there is an increase or decrease. Otherwise, it doesn't prove anything. Now, if you have done a study in Bhubaneswar, then don't suddenly extrapolate it to the whole of Eastern India. It may not be possible. So, because there are different things which would be your confounding factors. So, that these are some of the ways in which we tend to overinterpret our results. Okay. Now, what to avoid? You need to avoid what is called the bully pulpit. Bully pulpit is nothing but people who are in power. They think that by they can push their agenda forward by saying something. So if you are, let's say you are somebody who is um, a proponent of intermittent fasting, that doesn't mean something else doesn't work. So just because you this is your point of view, it doesn't mean you use your study to push your agenda. Remember, this is a scientific paper, so you need to give both the pros as well as the cons, and avoid conclusions which are not supported by data. I have already spoken to you. And then preaching to the reader. Now, sometimes people tend to also bring down other workers and talk as if your work is the best. So you need to be a little bit careful, be scientific, and limit your discussion only to what findings you have. So, sorry, this is again come. I'm sorry, there's a repeat. Okay. So this conclusion is not supported by data. See, there was a study in which they had two groups. Okay. So the study reported that the yoga group did better than the controls. And that was a finding, that the students or whoever did, the volunteers who did yoga did better than the control group. But when they actually looked at the paper, they found that the researchers compared within the groups. So the pre-post for the yoga group was significant, right? They did not compare post-yoga with post-control, which is what they should have done. So if you have two groups, you have to compare them using the proper statistical test. You cannot look at the results and do a comparison which is showing better results. That is what we mean by conclusions not supported by data. And this, you can see this Altman has spoken about this in this Rishikesh Subramania, these people's paper in International Journal of Yoga. This is what that example they were giving. So you need to interpret scientifically. See, this is not a philosophical discussion which we are doing when we are writing the discussion. Is the glass half full? Is it half full or is it half empty? But actually, technically the glass is always full because there is half is water, half is air, isn't it? So we need to interpret scientifically. We are not talking of philosophical interpretations like this. I can't say I am not overweight, I am under tall. Okay. So this is not what should be done with your interpreting the results. So you need to do post hoc power calculation. In case you're not finding any difference, you may want to do post hoc power calculations. You need to think about who are your controls. If they are healthy controls, how do you know they were healthy? Were they checked up? Or are you generally, what happens, some patient comes, you just catch his attendant and make them their control. Is it actually a control? You need to talk about that. Then what is the setting? An institutional setting will be very different from a community setting. So when you are extrapolating or when you are interpreting, be careful, because community setting might be completely different from an institutional setting. Then the sampling frame. Did all the potential participants have a reasonable chance of participating in the study? Have any biases crept in? Supposing we use some tools which have been done in the West, some questionnaires. which are ideal for the West. But if you use those tools without looking at our cultural context, people won't understand it at all. Okay, so you need to see about biases, uses of tools, sometimes the outcome measures which are measured 24 versus 48 hours, and things like that. If you look at the aim of research, it is generally to seek the truth. So the aim of any study is to estimate the true value. Okay, so that is what we say, the true value of a health event or disease association. So the common mistakes in writing in the discussion, this is generally seen all over, especially thesis. Again, people start writing it as a review of literature. Because I have said 4 or 5 pages, they don't know what to write. So again, they will say, our study, we wanted to see whether this happened, and whatever was in the review of literature, they will write at least 3 or 4 paragraphs on in the discussion. Please don't do that. The other thing is people tend to hide the limitations of the study. There is a general feeling, if I tell what the limitations are, maybe the referees or the examiners will think less of us. This is very wrong. Actually, if you write your limitations, it means that you are interpreting your results in the light of your limitations, which is what you are expected to do. These are my results, but I am interpreting it in the light of my limitations. For example, now you are having this COVID. You are not able to do the full sample size. So your sample size will be less. The power of your study will be less, isn't it? So there's no point in hiding the limitations. You please put it out openly and say, in the light of these limitations, these are my findings. The other thing is you have reported so many results, but you don't discuss all of them. You only discuss those results which are going with your first hypothesis. And this is not correct. Because at the end of it, you might have a negative study. That's all right. This is a thesis. You looked at a research question. You had a reason for asking that research question and you asked it. So there is no harm in you trying to say that these are the results. So do not rewrite the results again. And then conclusions not matching with objectives. For me, no, this is the biggest irritant which I see in most of the theses. Because when you have objectives, I will generally look at the objectives and then turn to the conclusions and see whether it matches. So if your first objective is to find out whether the drug has caused a decrease or increase in heart rate or blood pressure or something, your first conclusion should be this drug did not increase or decrease the heart rate. It cannot be this drug did not have any toxicity. So please check whether your objectives match with the conclusion. So whatever conclusions you are writing in your discussion, this should match with the objectives. It cannot be something which is not sought in your objectives. Okay. So you need to avoid some confusion in your conclusion, because conclusion is normally the last part of the discussion in a paper, in a manuscript. Because in a manuscript, there is no separate conclusion part. But in a thesis, sometimes people ask you to write your conclusion. So the conclusion is the summary of everything you have said so far. Okay. This is the conclusion. Sometimes you are expected to write a summary. Summary means you are going to write from the very beginning. You are going to write from the problem, identification of the problem, your objectives, your methodology, everything will go into summary. Okay. So conclusion is the summary of everything which you have said so far, and you look a little bit further. Okay. So in the conclusion, if you are going to write the conclusion as a separate section, you will restate your hypothesis or research question, restate your major findings, and tell the reader what contribution your study has made to the existing literature. Then you highlight any limitations of the study and the future directions for research or policy recommendations. This is what you generally write in the conclusion. If it is part of your thesis as a separate section, you can write all this in the conclusion. Okay. Now, one of the key things which we all need to do is to use reporting guidelines. This by itself is a separate topic, so I'm not going to tell very much, but they are versatile tools. And now you find a reporting guideline for almost everything. So therefore, please use them. They can be chosen based on your study design. So you have a whole lot of reporting guidelines. The common one which we use for clinical trials are called consort guidelines. But you can use it to design your protocol. We generally ask students, you have it and design your protocol. It is used for reviewing papers. Many journals ask you to use the checklist, and when you are reviewing papers, and we can use it for training. Now, these guidelines don't evaluate quality, but they are. But the thing is, they make sure that all the elements are properly reported. So these are reporting guidelines. And in a thesis, what are you doing? You are reporting your research. So therefore, these should be used in your thesis. So there are a whole lot of guidelines for different types of study types. You can choose whatever you want, and you can get this from this Equator Network. So go to this Equator Network website, and you can choose whatever, depending on your study design, you can choose the correct reporting guideline, and you should use it. So I'll conclude by saying discussion permits authors to explain what the study means to them. Keeping the 5 elements helps one stay on track. The 5 elements stating the main findings, then comparing it with other studies, then what are the strengths, what are the limitations, and then finally conclusion. So these are the 5 elements you need to look at it. Then you use the reporting guidelines whenever necessary, and then you need to avoid the common mistakes. Common mistakes are generally repetition. Don't repeat the review of literature, repeat the results, and so on. Mostly it is the repetition which is the common mistake. Otherwise, sometimes also we tend to, over interpret the results and so on. But otherwise, basically the major mistake is to repeat too much about of the review of literature and the results. So thank you. And with this, I will now open this for some questions, please. Yes. Yeah, so Dr. Rashmi Jaiswal has said, this article started with his finding. Is it the correct way of writing? See, this is not, the article did not start with it. What I showed you is the discussion section. The discussion section started with his finding, and that is how you start the discussion section. Okay. So it is correct, because he is not starting the article. The article will start with an introduction, isn't it? So this is not the introduction. This is the discussion of that paper. So maybe I didn't properly explain it. Yeah. Any other questions, please?
Ma'am, good evening, Satyajit here.
Yes, Satyajit. Yeah, please.
Ma'am, the reporting guidelines that you mentioned, shouldn't they be the part of the results? Because when we put the results, we say that figure 1 is the prisma or the consort diagram, and so on and so forth. So is there a place for the reporting guidelines in the discussion section per se?
No. See, the reporting guidelines tell you what should be written in the introduction, what should be written in the methodology, what should go into the results, what should go into your discussion section. Okay. So the reporting guidelines actually tell you how to structure your entire paper. That is why they have a checklist. And in that checklist, one of the things they say is that you must have, if you've done a clinical trial, you should have that one algorithm they ask you, that how your study has been designed, that thing. So actually many people make a mistake by saying this is a consort checklist we are putting. Consort checklist is not needed here. Consort checklist is for you to keep and say, yes, I have written in the introduction, I have justified my study, or I have identified the gaps. In the methods, I have stated the setting. I have stated the, sample size estimation. So the consort checklist is for every part of the paper. So what we are saying is use it for your thesis also, because the checklist, consort checklist is mainly for manuscripts, but there is no harm. The same thing goes into your thesis. So it is meant for every section of your thesis. Am I clear in this?
Yeah, okay.
Yeah.
Thank you, ma'am.
Yeah. Ma'am, if my study is not having. No. See, what you're saying is, see, if your your study is not a flop. See, someone has written, if my study is not having or able to prove my hypothesis, and it's a flop, what can be written in strength? Example, in a RCT, the intervention in the community turned out to be ineffective in my locality. So that's fine. See, this is what you have found. So what you can say in the strength, you will say that you had your proper sample size. Your sample size was good, and you randomized it. And if it was, which was your control arm. So these were the strengths of your study, if whatever you had done. But despite all this, you had a negative this thing. So now try to explain why you didn't have it. So don't think that it is a flop. See, this is what you have found. So you have expected something, but finally you did not get something. So try to explain why you didn't get that finding. So this might be the truth, no, which you are saying. Supposing your sample size was too small, then you write in your limitations that your sample size was too small, and probably because of that, you have not got the correct result. Okay, is summary mandatory or optional for thesis? I don't know. I think it is mandatory. Rituparna, in AIMS, summary
Yes.
is there or what?
Yes, ma'am. We asked to write a summary. It is mandatory for us.
Yeah. So we write. So summary is in a thesis. It is good that you write the summary, but summary is almost like an abstract, but a little more than the abstract. So you need to write a brief. What was your problem? 1 or 2 sentences. What was the gap, and what was your objectives? Then your methodology. Then your results. Then your discussion. So everything should come into your summary. Can we highlight the tool which is there in methodology as a strength? Yes, of course. Supposing you have done a tool which you have checked it out, you have translated in your own vernacular, you have back translated, then you have done all those things which you do for a tool, no? That what is that face?
Validity.
Validity, yeah, you check all those validities and all that. If that is a strength, please go ahead and write that it is a strength. Why not? If you have already done a little bit of work on your tool, you should. Yeah. Any other questions, or anyone wants to ask something? Yeah, okay.